Kendra in, make her the host.
Hey, Kendra. Uh-oh, she's still on mute.
Hey, I'm here.
Okay. Okay, I'm gonna make you the host here.
Ari, can you let me in and maybe make me co-host in case there's any issues?
Okay, give me 1 second. Kendra's now the host. Oh, Kendra, since you're the host, you'll have to let Megan in and make her the co-host.
Okay, it looks like there are a bunch of people waiting to get in. Megan, I just admitted you first, but do you want me to let everyone else in now?
Okay.
Or do you want me to wait?
Kendra, do you have it? You have the PowerPoint? You don't need me to do the PowerPoint or anything, right?
That is correct. I am gonna try to make you a co-host though.
Co-host.
Yeah, because I can deal with the chat and do all that while you're talking.
Yeah, I think that would be great.
Okay, thank you, Ari.
Oh,
Thanks,
you're welcome.
Ari.
Did you need me to just leave my laptop up just in case?
I think we're okay.
Okay.
Thanks.
Oh, you're welcome. Bye.
Okay, Kendra, go ahead.
Okay. Hello, everyone. We'll give people just another minute or so to join us. So as you guys are joining, if you could drop your name in the chat, that would be great. I'll introduce myself in a second once kind of everybody is here. All right, I'm going to go ahead and get started just because we have a lot to cover and I want to make sure that you guys get all of the information. My name is Kendra. I'm the Assistant Director of Digital Media and Strategy at HLM. I've been at HLM for almost 9 years now, actually. And I do a lot of the graphic design, digital media, video animation, social media at HLM, both for ourselves and also for our clients and partners as well. So I'm excited to get to hang out with you guys for just a little bit this morning and talk about social media. I'm going to go ahead and get started. If you guys have questions as we go, my coworker Megan, who I think you all know already, is here and she'll be kind of monitoring the chat. So just feel free to drop questions in there and we'll make sure that we get to those. All right. let me share my screen. All right, I'm going to give it a minute to load. And I'm actually going to turn my camera off for the presentation since you guys will be looking at the slides anyway, just so that everything runs smoothly with Wi-Fi. Okay, I'm going to go ahead and get started, but please speak up if you cannot see my screen at this time. So like I said, today we'll be talking about social media, specifically how we use health practices to connect with folks on the web and help our partners and clients do the same as well. So we want to start off with the basics, right? So what is social media? So social media looks like web and application-based communication tools, whether that's a website or an app platform, to allow people to interact with one another by sharing resources, information, and receiving those same resources and information. A lot of platforms we've dropped here. Of course, there are significantly more. Social media is always evolving and changing, and new platforms are popping up and going down. But we just included some of the most popular ones at this particular time right here. So we have Facebook, which is the largest social media networking site and the most widely used. So people can create their own profiles, but also brands and organizations can create their own pages that then people can like. Twitter is another really popular platform, of course. I'm probably telling you guys things that you already know, but Twitter now looks at the 280 character limit, but you can also include still graphics, links, videos, all of that good stuff. LinkedIn specifically for the more professional communication and social media, looking at people's professions, what they do, their careers, things like that, and connecting people based on those professional relationships. Instagram is, of course, more photo and video based. People are using Snapchat, mostly young people, of course, but organizations are on Snapchat now more as well. YouTube is probably the second biggest. So thinking about all of the videos that people are watching and sharing, YouTube obviously gets very high on that social media list. TikTok is probably one that's blown up really over the course of the pandemic. People are using really short video clips, just taken on your phone to share information and stories and experiences with one another. Pinterest is probably less used for health purposes, but it does still exist, of course. And then there's Nextdoor, which some people use in their neighborhood, Reddit, and WhatsApp as well. And we'll get more into some of the more popular ones as we continue throughout the presentation. So the interesting thing is that about 7 in 10 people now, so the majority of people have and use some sort of social media. And thinking about what that looks like specifically on the various platforms, specifically for the different age groups, you can see here in this chart that I have on the screen, kind of the breakdown of the age ranges that were used in this study, as well as the different platforms. So you can actually see here that YouTube is the most universally used, with 81% of US adults using it. Facebook is the one with the least age gap. So a lot of people will say that older folks are not on social media, and that's not true. A lot of people are on social media, specifically Facebook. That's the one where there is the least amount of space between the age gap. So more people are universally on Facebook than some of the other platforms. One thing that's not included in this chart, but I thought could be of interest, is WhatsApp. So WhatsApp is the third most popular in the world. It's only 25% of US adults, so it's not as popular here, but we know that a lot of people that are here in the US will communicate with people in other countries and other places using WhatsApp. It's significantly more popular in other parts of the world, but it is a way that people here connect to people in other parts of the world as well. I wanted to talk a little bit about how social media is used in the context of health. So among healthcare providers, professionals, and organizations, health related social media is used to disseminate health information, monitor diseases and pandemics, which of course we've seen a lot of, health promotion, clinical trial recruitment, and social media-based health interventions as well. So just thinking about the ways that the providers are specifically using social media to communicate with people, the general public. Now, among the general public, social media is used a little bit differently. So people are using it to learn more about their diagnosis or treatment options, get advice from other patients with the same condition or caregivers who may be in the same situation that they're in, receiving social support, sharing health information, and watching health-related videos is another big one as well. One of the reasons why social media is so highly used for health communication is because of some of the benefits and some of the things that it allows to be true that aren't necessarily the case with other types of media or communication. So social media makes health information more accessible. So you're able to use a variety or a mix of mediums and platforms. You're eliminating some of those physical barriers, thinking about physical location, people who may be harder to reach. And it also makes it more equitable because the majority of people, as we know, use some type of social media. So not everybody is going to be going to the CDC website or a local public health department website because they may or may not know those resources even exist for them. But your reach increases significantly on social media, either organically or through other people sharing information. It also offers greater social and emotional support by putting people in touch with others who they can relate to and connect with. So that gets at that point from the previous slide about people being able to talk to other patients who may have the same condition or be in a similar situation that they're in. It also increases interactivity and engagement. So with increased reach, you're going to get more engagement. And the big thing about wanting to get more engagement that it's important to remember is that you have to make sure that you're posting the content that garners engagement and that is interesting to the people that you're serving. And we'll talk a little bit more about that later. Social media is also one of the more low-cost dissemination methods. So there's no extensive graphic design costs or printing or shipping costs. Of course, these are all things that you can still pay for and do, but with social media, the dissemination is essentially free unless you want to then boost the post or boost the content using ads. It also allows for higher capacity for tailoring messages. So we see this all the time with videos and illustrated graphic content. It's way easier to be able to be more representative and tailor visuals and text specifically to the people, the audiences that you're trying to reach, which we know when you tailor information, it is of course more effective because it's specific to that group of people. When you do things like use photos or live action videos, you don't have the flexibility of being able to reach all of the people. Similarly, like I mentioned earlier with physical location, it may be harder to kind of get information out to those people in a way that they understand, in a way that resonates with them. But social media allows us to do that a bit more. One of the things, and I know you guys have learned this by now, being in our other health literacy trainings, but health information is not always written for how people read, understand, learn, and act on information. So whether that's the language or the design of the material, the format or the flow, health information just overall is not supporting people that it's intended to serve and to educate. Because of this mismatch, people are not rushing to read the 11th grade scientific articles. They aren't popping over to the CDC website just to see the latest updates. They may not even be asking their doctors or providers for additional information because of jargon or other reasons that they may not understand the information. Because of that, so we have 7 in 10 people tend to turn to social media for more information on their health. And they're looking for reliable information. Now, whether or not they are able to assess that the information is reliable and access information that is reliable or fall victim to misinformation is a completely different story. So misinformation, as prevalent as it can lead to negative health outcomes. At the same time, we know that health literacy evidence and best practices, improved comprehension and recall are specific and touted evidence and results that we see when we use those health literacy best practices. We know that it can help people make informed decisions, which can then lead to positive outcomes, whatever that means for them and their health. All right, so I want to spend a lot of our time talking about what to post and how to post and giving you guys tips. So we're kind of going to get into that content next. So you want to post content that resonates with your audience. Again, I'm sure you guys have talked and been thinking about this a lot with our other health literacy trainings, but thinking specifically about your audience and your purpose. So who are the people that you are trying to serve? Are your posts geared towards patients, providers, caregivers, other professionals? This is going to influence the type of content that you post, of course, and also influence the way that you make the content as well. One of the things that you want to think about, kind of touching on that purpose aspect, is what do you want people to know or do? And what do people want to know or do as well? So you might have everyday goals that you think about the purpose for the specific post that you're posting. So you might post something that is encouraging people to schedule an appointment or get a vaccine. Those may be specific purposes for individual social media posts. However, you want to think about these goals and these purposes within the context of big picture goals. So one of the things that we always like to do is get people thinking about, okay, so you might have these specific goals for a specific post, but what are the big picture things that as an organization or that as a particular profile on social media that you want to try to get at? So that could be something like increasing knowledge of local resources, increasing brand or organization awareness, establishing trust as a reliable health information source, or even just improving the health of people in your community. And you do not necessarily have to pick just one of these, right? Like you could have a strategy that touches on some of these different points. One of the things that we also encourage people to do is when you're thinking about posts, think about the things that make up a post. So most of posts are made up with some kind of visual content, a short caption on a relevant topic that is relevant to your audience and to the times, and any relevant hashtags that allow you to tap into already happening conversation on social media. One of the things that we always like to do is encourage people to include visual content. And it's a lot easier now because there are a lot more different platforms and things that you can use to create social media messages and graphic content, but also the algorithms that are present within these social media platforms. So thinking about which information is seen and how, they work based on people viewing visual content. So it's another kind of reason to just make sure that you're including that type of content in your messages. When we talk about visual content, what do we mean? So it could be an image, which would include, photos, graphics, even infographics, quotes, things like that. Links that would go to additional web pages, articles, events, or other posts. And video or GIFs. And that's a big one because video is probably the biggest thing on social media. Most people go to social media to view videos. And we're talking with that about animated content, such as digital stories, motion graphics, things like that. It could also be live action content, such as interviews or testimonials or footage from behind the scenes at events. Anything that gives people something to see and relate and react to are the things that you want to post on social media. So while we encourage, of course, all visual content on all platforms, there are some platform specific things to keep in mind. So videos and attention grabbing links get the most engagement on Facebook. So when people are on Facebook, they're, scrolling, clicking into additional links, looking at videos. While people are looking at links on Twitter as well, Twitter is also geared towards more well-timed trend participation. So tapping into those hashtags, looking at the memes, figuring out what people are talking about, and tapping into those conversations on Twitter works best. Instagram, we know that started with photos, so that's always going to be their big thing, but also video content is getting a lot of engagement on Instagram as well. And then, of course, with YouTube, the biggest thing are actual videos. I want to kind of give you guys tips as we go, right, about how to kind of craft a social media strategy. So one of the things to think about for that is how you want to break down your post content. So a lot of people talk about using the rule of thirds. And what that means is kind of breaking up your strategy, your approach into 3 different categories. Now, this is not to say that it has to be 3 categories or that you have to choose these 3 specific categories, but this is just an example to think about how you might segment your content. So the ones that we have here are education, promotion, and conversation. So education could be content developed or shared to help the public better understand health and make informed health decisions. Promotion might be content to promote the service or your organization, a specific event that you're having that you want people to be aware of and attend. And conversation could be just content that generates or contributes to conversations that are already happening about health in the world and or specifically on social media. Again, you might decide that you want to break things up a little bit differently. For us at HLM in our social media, we've kind of broken ours up to include education as one, promotion and conversation as kind of a second one. And then our third one, we have a specific program that's about clearly communicating clinical trials. And we want to make sure that we're posting information that really supports that program. So that's kind of how we've broken up our third. That one has its own. So like I said, that's just how we've done it, but that's not to say that that's how you have to do it. You could have 4 things, you could have 5 things. You don't want to get too many because you do want to be able to kind of focus and segment your content and be able to track to say, hey, we haven't posted anything that's about promotion in a while. So maybe let's go ahead and post something that's specific to a service that we're seeing that people aren't attending very well, or a service that people are loving. You have the flexibility to do that within your own strategy. You may also decide that you don't want to break it up evenly into thirds, like is what's here on this graphic, and that's also fine. At HLM, we are heavy on the education because we want to make sure that people are aware of health literacy and what that means and what that looks like and how professionals and providers can use it to communicate better with patients. So for us, our education section is a little bit larger than some of the others, and that's okay too. What I would probably steer you away from would be just promotion. So if you are only posting posts about how great you guys are as an organization, people are going to see that as more ad focused and not think of you guys as a source for health education information. So you also want to think about how people will be receptive to the information that you're putting out. You also want to vary your post content for the platform. So that could be image size and dimensions, the length and the format of video content, the hashtag that you use or the account handles. So for example, on Instagram, we're Health Lit Media, but on Facebook, we're Health Literacy Media. So when people are tagging us, they will need to tag the appropriate handle based on the platform that they're on. Tone and length of the caption also matter as well. So you might adjust that based on the platform that you're on. Here are a couple of examples. We just picked a caption and kind of broke it up into how we might post it on different platforms. So for Facebook, we said, if you still haven't gotten your COVID-19 vaccine, our booster event is this Saturday at Forest Park from 11 a.m. to 4 p.m. We hope to see you there. I have in brackets share event because there could be an event that we create on Facebook that then people are able to RSVP to and see more information. On Twitter, we might say, something a little bit more quippy, like still need to get your COVID-19 vaccine booster. We'll be at Forest Park Saturday from 11 to 4. Join us. So we want to keep it short and sweet. You could link an event page, or you could put a promotional video or some kind of photo maybe from the last event. With Twitter, you're able to post more frequently. So we also included a secondary post that could say, not sure if you need a COVID-19 vaccine booster, visit this web URL to find out more. And so that could be a link that's specific to a material or a web page that talks about who needs to get the COVID-19 vaccine booster and when they need to get it. So scheduling as well. On Instagram, we kept it at, we'll be at Forest Park Sunday from 11 to 4, giving COVID-19 vaccine boosters. Not sure if you need a booster, click the link in our bio to find out more. And you could put photos from either something that is relevant, so if people kind of getting a vaccine or being around, or you could post photos from your last event. So that's just, it's subtle, but there are differences among them that kind of resonate more with how people are viewing and expecting and perceiving content on the various platforms. We also wanted to talk about when to post. So there are strategies that are out there that talk about kind of when to post to best deliver content and get the engagement that you're looking for. So we'll include some of this in our takeaway. I'm not going to jump into it fully, but I do want to kind of just call out some things. So Tuesday, Wednesday, and Thursday in the morning are kind of the times for consistent engagement. You'll see that over Sunday, there's an X, and that's because Sunday is just, that day does not really get engagement, and people recommend that you're not posting content that you really want people to see on Sundays, because they're probably not going to see it. Specifically thinking about the platforms, weekdays, very early and mid mornings have shown consistent engagement, and Saturday, again, is probably not the best day to be posting on Facebook. For Twitter, peak engagement is mid morning and midday throughout the week. Sunday, again, is not a great day. Thursday is all right, but if you can, of course, post during some of those days or times that are most popular, then you want to do that. For Instagram, midday engagement during weekdays is more dense, so that's when more people are engaging with content. And then for YouTube, Wednesday through Friday in the afternoon is the best time. And this is not to say that this is when you post. So we'll send you this and you can take a look at it, but that's not to say that if you post any other time that it's not going to be, you're not going to get engagement. These are kind of the averages that marketers are seeing across social media. However, we'll talk a little bit later about specific analytics and things that tools and things that you guys can use to figure out when your particular audience is engaging most and what posts they're engaging most with. When you think about how often to post, Facebook as an organization, of course, you're looking really to just post once a day, same with Instagram. But like I mentioned earlier for Twitter, Twitter kind of is, because it's more of that in the now type information, you can post more. So if you were to post like 5 times on Facebook in a given day, that would feel like a lot. But of course, if you're on Twitter, because people are posting more frequently, the posts are shorter and easier to digest as well. You might find yourself posting more on Twitter, so you can make sure that people are seeing you and you're getting that engagement. Social media stories. So I added this slide in just because I feel like stories are a really big thing, and I feel like we'd be remiss not to mention it. So social media stories are spontaneous or casual 10 to 15 second photo or video clips, essentially. And most of the time, they only last 24 hours. This really started with Snapchat. which you can see on the bottom is one of the platforms that allows stories. TikTok just kind of started implementing stories, but most of them only last for a given period of time. The content is up. If you miss it, you miss it. But of course, you can always screenshot content and save it for later. What do people share on stories? So behind the scenes content, people might do polls, questions, Q&A, posts from your feed just to kind of promote the content that you've already posted, announcements and updates and services. So again, all of this varies by platform. For example, Instagram is really good for people asking you questions and you answering them across the different stories. But for Facebook specifically, you might do more behind the scenes content, or you might do more announcements. For Instagram, you might also do posts from your feed, because you can take a post and kind of share it on your story to get more people seeing the post than would have if it was just on your feed alone. Like I mentioned, I wanted to talk a little bit about analytics as well. So analytics are really kind of the metrics and measures that are used to help you assess who's looking at your content, so who your audience is, the content that they actually want, so what content is doing well, and also the best times to post. So within the platforms that more frequently do analytics, so Facebook, Twitter, Instagram, and YouTube, you can look at analytics specifically within those platforms. I think for Facebook, it's called Insights. For Twitter, it's Analytics. So the language changes, of course, just a little bit, but the essence is that you're trying to figure out who's looking at your content, what they want to see, and what's performing well. And so all of this you can do within the actual platform. Once you kind of take an audit and see, okay, who's looking at your content, what's doing well, then you want to just go and start, posting content that is relevant, of course, based on what you know. So create the posts and the content that speak to your goals and your audience. The thing is, you're also going to need to take some time to review the analytics after that as well. So once you post this content, you want to track how the content is performing and adjust your content creation and publishing times as necessary to make sure that you're really catering towards your specific audience. When you're looking to use analytics, some of the key points of interest and metrics are audience demographics. So you're able to see, countries or states, sometimes even cities, depending on how granular you're getting. For the people that are looking at your content, you can see gender, other sites that they're going to based on their own web browser history. You also want to look at reach, which is how many people see your post at least once. And then for engagement and interactions, the definitions and language varies a little bit across the sites, but essentially engagement comes down to likes and clicks, and interaction looks at comments and shares. So the number of comments that you get on a post, the replies to those comments, and shares on personal or organizational pages, depending on the platform that you're on. So as you guys are looking at analytics, these are some of the things that you want to look for and keep in mind and really start to track. Analytics and scheduling apps exist to kind of help you automate your social efforts. So you might want to look and see what platform fits your needs best. So whether you want help with scheduling or analytics or both, the social platforms that you use, not all of the schedulers and analytics work with every single platform. So you want to make sure that if you are choosing one, you're choosing one that fits with the platforms that you use most frequently. Style and user friendliness, depending on who's going to be looking at the information and how the information can be presented or reported to other folks on your team as necessary. And then, of course, budget. So all of the analytics, like I mentioned from the slide before, are already included in those social media apps. So of course, that is no additional cost. Another thing that has become more popular recently within Canva specifically is creating posts in Canva and then being able to schedule and post them through Canva, which of course is the platform that you use to create the messages. And there are other platforms like this as well. But there are additional platforms where their sole purpose, or one of their main purposes, is to kind of aggregate this information of your analytics and metrics, and also schedule content for you as well. So I've just listed a couple up here. There are way more than this, but these are just a couple of the popular ones. So Hootsuite has probably been around longest. Sprout Social exists. Planable mostly does the scheduling and the publishing for you, which is what we use. But HubSpot is also another great option, and we're actually looking at that for analytics at HLM. When you go to like the benefit, I guess, of these publishing apps is that you can plan and schedule your content in advance. So looking at the times, looking at those analytics that you saw, and looking at the times of day and the days of the week that work best for your specific audience, you can create a bunch of content and then schedule it based on those times, which frees you up when you're doing other work. You don't have to be like, oh, it's 10:30, like this is our most popular time. I need to stop what I'm doing, switch over, post on social media, and then go back to what you're doing. The benefit, I think, of scheduling is that you can do it in advance and then let it just do what it does. The only caveat to that I always encourage people to do is to be aware of what's happening in the world. So there is a lot happening right now. I don't need to tell you guys that. And that's going to influence the content that is on social media. But you want to make sure that you're posting content that is appropriate for the here and now. And if you need to, unschedule, pause, or pivot your content as necessary. So, for example, there was an NBA game a couple weeks ago, and one of the team that lost, they I don't know who it was, but someone had posted, I think it might have been like a Ruffles chips ad or something. But it was about one of the people on the team that lost, and people just felt like it was very poor timing after like the award ceremony, that then there was like this ad that was specifically about someone who was talking about, you know, how great their team was and how, you know, they were going to do really well, and then ended up losing that game. So that just goes to show that people are watching and people are paying attention, and you want to make sure that you're posting content that is relevant and that works. That's more of like a lighthearted example. Thinking about just a lot of the stuff that's politically happening in society, you want to make sure that whatever you're posting promotes whatever it is that you believe and say for your organization, or if it makes sense to not post something in that moment, then make sure that you do that. To be effective with social media efforts, you really need to be dynamic, clear, and contextual, which are all things that we've talked about in other trainings as well. So what our process is for how we do what we do for creating this social media content, we develop a clear and simple message. So thinking about the target audience, what they want to know, and what would be most impactful for them in their lives and decision making. Creating content that then supports your message, so visuals or animated content using either a desktop or some kind of mobile app, or a professional vendor as well. Testing your message and your content, so showing your message to someone else to make sure it lands well, it lands as it's intended, and then edit as necessary. Ideally, you would want to test your content out with someone from your target audience, but if that's not possible, then you want to test it out with other people, perhaps at your organization or that you know, just to kind of get an idea of how it might go. And then sharing your content on your platforms. So when you share, we want to make sure that we're tracking the engagement, like we said, and then again, adapting and editing as necessary to make sure that we're giving people the information that they want and need to know. All right, so now we're going to get, I know I've kind of been dropping some tips throughout, but now we're going to get to the actual tips section. So tips for health literate social media content. The first tip is to keep your message simple. So make sure that your message is easy to read and understand, and avoid using jargon. We've also included some questions here as well. So the first question is, or the first, I guess, Yeah, I guess it's a question. It's true or false. People prefer to receive health information written at their reading level. And you can drop your answers in the comments or in the chat, and we will look to see as well what people are saying. A lot of people say true. Yeah, more truths. All right. Okay, so the consensus here, it feels like people are saying this is true. People prefer to receive health information written at their level. Spoiler alert, it's actually false because everyone prefers to receive health information written at a lower grade level. So studies show that even people who can read at the 10th and 11th grade reading level, people with doctorates and master's degrees and all of this stuff, when it comes to health information, specifically, people want information that's written at a lower grade level so that it's easier for them to understand, use, and act on. Okay, another little question activity for us. How would you rewrite this message for social media? So in, general conversation, you might say, here's a tool that patients can use to determine vaccine eligibility. But that uses kind of some jargon and isn't as friendly and approachable. So we might not want to use that same language on social media. So how would you rewrite this message for social media? And you can just drop a couple of examples again in the chat. Okay, people are saying here's a tool that will help you find your vaccination options. Click here to find out when you can get your vaccine. Vaccines, check this out. Use this quick tool to find out when you get your shot. I love that. I love that you guys are, first of all, participating, number one. But number two, are swapping out some of the words that may be a little bit more difficult, that you're trying to make this more conversational. It looks like someone threw a hashtag in there. Love to see it. These are all great options. What we went with was use this tool to find out if you can get a COVID-19 vaccine. So similar to what a lot of you guys were saying, we want to keep it simple, short as possible, getting rid of some of those tough words like eligibility and utilize, things that people are not using in their everyday language and that are not super familiar and can convolute the message. Tip 2, write for your audience. So again, a personal friendly tone, like we talked about, can go a long way. You also want to make sure that you adjust the language for your audience using words that really resonate with them. Another short answer for you guys. How would you rewrite this message for social media? There are a number of resources designed to help patients with low health literacy with medication adherence. Find out more. So again, thinking about the tone, thinking about the words, what sounds more friendly and what also sounds like something that you guys would want to click to find out more. Like, I'm not sure, there are a lot of there are a lot of words in this message that are complicated. Medication adherence. I'm not going to think that you're going to be writing information that I want to read if you're using words like that, right? Because I know that it's probably going to be a more higher reading level piece of material. And that might not be what I'm looking for when I'm just scrolling on Twitter. Like, I'm not trying to go into something that deep, right? So what's going to actually catch my attention and make me want to find out more? Need help with taking your meds? Click here. Not sure about when and how to take your medications? Click here for more. Having trouble understanding? Click here. I love also guides to make it easier for you and a loved one. These are great, guys. I love that you're so engaged. Okay, click here to find out more information, know your health IQ, click here for more. Are you taking your meds the right way? Love that. Questions are really good, right? Like, questions are a really good way to kind of pull people in. So we said, have questions about taking your medicine, check out these great resources with tips for getting the most out of your trip to the pharmacy. I love a lot of what you guys said as well. So do not think that because those are not the things that we wrote that those are bad answers. I think that you guys are clearly getting the concepts about breaking down these messages and making them more conversational using words and language that actually pull people in. Tip 3, fact check your information. So use information from credible sources and fact check using more than one source. I know that a lot of you guys are in public health, so I do not doubt that you're already doing that. But it is important to fact check to make sure that you're putting the right information out there, particularly as you're wanting to be seen as a profile or an organization or a brand that people can turn to for trustworthy, reliable, and accurate information. All right, true or false? 44% of people reported that they were not confident in being able to tell whether health information was accurate or not. We've got some trues. True or higher, I like that. Some people are saying higher. All right. It's true. So almost half of the United States of adults in the United States are not confident with being able to tell whether health information is accurate or not. So you've got a lot of people who are concerned about whether or not the information that they're reading is true. So I think that just speaks also to the fact that people are not always going to know when things are misinformation. So as health professionals, I think it's important for us to be that source of true and accurate health information and help people to assess also how they can see whether information is true or not. So giving them some resources and questions to ask to do that. I also saw a question. How do I get my health director to allow me to use this type of informational language? So I think that the answer here is the evidence that exists. So we know that people are going to respond more to this conversational language. We know that people are going to respond more when we're not using jargon, when we're keeping it short and sweet, when we're making it engaging. There is evidence to show, studies that show that this is what resonates with people, and also that this is what helps people understand information. So at the end of the day, for me, it comes down to understanding information and what will help facilitate that. And there are certain best practices for language and design and for accessibility that support that. Oh, like this. Okay, someone also said, do you know about the stats? Yep. Could do a training. Yeah, that's great. I mean, and the thing about health literacy is that it's really relevant at every level. And we talk in some other trainings that we have about health literate organizations and how we start, you need that buy-in from the top, from the administrators, to be able to let health literacy really influence all of the other programs and services and communications and things that you have. So sometimes having some kind of training or a material that helps people understand why health literacy is important and why language and design matters can be helpful. Tip 4, use graphics to support your message. So you want to use relevant, simple, and modern graphics to draw attention to your post and also, like I said, to support the message. So if you're using a graphic that is not relevant to the text, people are going to spend more time figuring out what is the relation here, why did they use this message, and it's going to or why do they use this visual, and it's going to take away from your actual message. Quick question. Okay, specific websites to find graphics. So we use Canva to create our own graphics most of the time. And sometimes we work from templates, which I think I'll get at in the next couple minutes. But the CDC and the World Health Organization are also organizations that have on their own websites like different graphics and things you can use. They may not be able to be things that you can tailor specifically, but there are things that are on topics that will likely still be relevant and that you could post on your own. Public Health Collaborative, love to see it. That's also an option. Okay. Multiple choice. When asked, how do you take this medicine? 47% of people who received text-only instructions answered it correctly. How many people who received pictures and text answered correctly? We've got some variation here, 93, 71, 56. Less of a consensus in this one. So the answer is 93. So when people are receiving pictures and text, they're able to understand and use information so much more than if we just give them text alone. So as a graphic designer, I, of course, am a little bit biased because I love cool visual things, but there is also evidence to support that that is what helps people understand. Tip 5, use animated video with voiceover. So using audiovisual content, such as video, helps patients understand and remember health information more. Animations alone without the voiceover are not as effective, but we know that when you use voiceover, it really touches on, it gets people's brain moving in, the different parts of their brain are moving more and working together. And so that's why they're able to understand and remember health information more. Animated characters are more relatable than live actors. So I think a lot of people want to use live action video, and it is a really great option. However, we know that sometimes live action video can be more expensive. And we also know that people tend to kind of resonate and see themselves more with animated characters than, of course, if you just have a live actor who is, has one particular look or style. I think this is our last question. True or false, animated messages with spoken text are just as effective as illustrations for people with low health literacy? You've got both answers here again. All right, so the answer is false. Some studies show that videos result in more recall and positive attitudes compared to illustrations. So when you just have text, like that's cool, but when you add photos to that, you're going to get more comprehension, more recall. And when you add the animated videos with spoken text, that voiceover, you're going to get even more information, more positive attitudes, more recall. So again, I'm biased because I animate videos, but also I just love videos because they really help people understand in a way that text alone doesn't, and even help people understand in a way that illustrations don't as effectively do as well. Oh, I lied. There was one more question. Okay, social media videos generate how many more shares compared to images and text? So we talked about how it's important to have that visual content a part of it. But so when you think about videos, how many more shares are you getting? $600, $1,200, okay. $1,200. Like, guys, is that not the craziest thing that you've ever heard? Like, people, I mean, they say that video is king, but like the evidence shows that that's really true. Like, people are watching and sharing more video content than they are any other type of content in ways and numbers that are beyond belief. Okay, I have a couple tips. I'm going to move a little quicker through these because we only have a few minutes left. But tip 6, make your content accessible. So consider how people might use the content and how they might understand the content, and make sure that you're putting out content that helps people, the most amount of people, understand. So use high contrast colors for people with low vision, use voiceover and alt text, use captions and subtitles in your video, use language to reach the audience if they're speaking a language that is not English or whatever the primary language that you're posting in, and make sure that you're using large text as well. Okay, I'm going to tell you guys the answer to this question because we have to keep going. Okay, how much video is watched without sound? 80%. So this is my plug for making sure that you're using closed captions and subtitles in your video, because most people, regardless of whether or not they are hearing, watch video without sound. Tip 7, post and share relevant content. You want to make sure that you're staying on topic and you're thinking about what the post adds to your overall strategy or campaign in your social media communication. You want to make sure that you're tapping into existing conversations. So adding simple and relevant hashtags that are easy to search for and easy to remember, and make sure that you're tapping into things that support also your message and your mission and your strategy as well. Review before you publish. So I always read things out loud just to make sure that it sounds right when someone says it out loud. That helps you catch things you might not otherwise catch. You can send messages to a coworker to review, which again, I do all the time. And like I mentioned earlier, be aware of what's going on in the world to make sure that what you're posting fits with your strategy, but also does not offend or put forth the wrong message. And recycle posts wisely. So it's totally okay to reuse posts. You want to make sure that you're doing them differently for the different platforms, like we talked about earlier. And also that when you're sharing the graphics or the information, that you're switching it up a little bit, just because you don't want to have the exact same content, because again, people will notice. All right, I did not leave us that much time for questions, which I apologize for. But if you have, a minute or two and want to stick around and ask questions, please feel free to do so. And also, it looks like someone dropped the link to Public Health Collaborative in the chat if people are looking for that as well. Thank you for that. Thank you guys for participating today. You guys were great. I loved it. It was a breath of fresh air, just the way that you guys were engaged with this training, and we really appreciate it. How can I see this meeting again? I believe it's being recorded. How do you get your supervisors to understand that we need to use more informal language with social media? So I would say, kind of to touch on what I said earlier, really making sure that they understand the evidence behind what we're doing. Because at the end of the day, for public health, it's about the evidence, right? It's about what we're seeing and what the studies and research actually shows. And there are significant studies and research and information that shows that this more informal language is better, period. So not just with social media, but it's better to help people understand, period, end of statement, mic drop. But particularly for social media as well, because people want information that is exciting and engaging, and that they can easily digest. And so that's what brings social media. We also know that people are turning to social media more because all of the other health information is written at reading levels or in formats that is not easy to understand. How do you keep track of what's going on in the world, especially trying to see both sides of issues? So what we do, we have posts that we schedule to go out. However, we always kind of have that last check of someone who is kind of just making sure that like everything is good with the post and the context before things go out. In terms of like how do you keep track? You just kind of have to be aware of what's going on. So just looking at Twitter and scrolling and seeing what's happening in the world, what people are talking about in the news. It's kind of that unspoken thing that is included in social media that no one talks about, but you just kind of have to just continue to have your eyes open and your ears open and see what's going on in other platforms of the world. These have been great questions, guys. All right. Well, this has been great. I believe you guys have our contact information. So if you guys have questions, feel free to reach out. We will also be sending you guys a takeaway document that has some of these key points on them that might be useful in your work or in your conversations with other people and thinking about the content that you create. And there was a survey sent to you, so definitely make sure that you take that as well. We'll send it through email if it hasn't been sent already. All right, thank you guys so much. Have a great rest of your day.